Hi, I'm Tim Friedman for Family Dental Care of Oak Park, where you are in for a truly excellent experience in every way, with expert, caring advice from a specialist to clinical mastery and cutting-edge technology to customer service rivaling Nordstrom, Ritz-Carlton, and Disney. Dr. Scapolato has carefully assembled the right team, training, and technology, just as you want to be very careful about the dentist and dental treatment you choose for yourself and your family. There are a few things you need to know to be an informed, knowledgeable, and capable patient, and we're going to cover those in the next important minutes. You naturally want to know what to expect and may be a little nervous. At the end of this video, your major questions will be answered. You'll be more comfortable and be better prepared for the success you want as a patient. So let's get started. You'll be glad to know that the dentist you've selected is a specialist. He's committed to maintaining the highest level of specialized clinical expertise possible through continuing education, information sharing with other dentists and medical professionals, and an investment in the latest technology. Make no mistake, technology has changed dentistry a lot. Today, with the aid of cone beam CT scanners, laser dentistry, medicines, and techniques, they have increased the precision of correcting dental problems, shortening treatment times, and ensuring more predictable results for you. Things like invisible aligners, anxiety-eliminating techniques, and many implant systems make more efficient treatment and greater patient comfort possible. Choosing the best option for you is a collaborative process between the informed patient and Dr. Scapolato as a caring and trusted advisor. You only get to make the right choices once, and the ramifications are not just temporary comfort or discomfort or pain. They extend for life to future dental problems and to a pleasing appearance and the self-confidence that comes with it. To you, the person watching this, who's going to be in the chair, you're going to get the very best and the most certain treatment possible here. Pain-free, embarrassment-free, in the shortest span of time possible, with the fewest office visits possible. If you know anything about cars, you know that Rolls-Royce is considered one of the most luxurious and high-end automakers in the world. People often refer to a product or service as the Rolls-Royce of its category, because the Rolls-Royce is such a superbly engineered and crafted automobile. It is the ultimate symbol of excellence, sophistication, and success favored by Hollywood celebrities, foreign kings, and queens. This kind of magnificence and perfection is exactly the standard that Dr. Scapolato stands for and strives to achieve with every patient's care, experience, and outcomes. You should only need one dentist in your life, one who is committed to such a standard and who has achieved a reputation for it. Rolls-Royce has never been about manufacturing efficiency. Each car is handcrafted, hand-built, patiently, and individually. Similarly, a dentist should not measure their success in terms of economic efficiency. How many patients can be served, how fast, in how little time, and at the lowest cost. For many other practices, these are the priorities. Frankly, focusing on such priorities can provide some services at lower costs and fees than offered in this practice. Such fee or price disparity exists in every business, product, and service category. You can stay at a Ritz-Carlton or a Four Seasons, a Hilton or a Marriott, a Hampton or Courtyard Inn, or a Motel 6. All arguably provide the same things: walls, a bed, and a bathroom. But your stay is temporary with no lifelong consequences. A smile makeover, dentures, and implants stay with you a lifetime. You can check into a hotel, and if mistreated or disappointed, you can simply check out and relocate elsewhere. Undoing unsatisfactory dental treatment is not so easy. The Rolls-Royce comparison is about getting everything right the first time. Not a week passes without some car company making the news with a big recall of defective and often dangerously defective cars. I can't recall seeing a Rolls-Royce recall. In short, the care and treatment decided on as most appropriate for the individual patient, for you, and the dentist and dental practice and its standards, its position on the Ritz-Carlton to Motel 6, the ordinary car to Rolls-Royce continuum, matter a lot more than whatever car you choose to lease or buy next, and arguably ought not to be simply decided on by price or price comparisons. Of course, only you can decide if a Rolls-Royce approach to diagnosis, plan design, expert treatment, care, and aftercare matters to you, and how much it matters. Obviously, it's not important to everyone. Now, if that sounds a little elitist, I suppose it is. However, our patients tend to be the kind of people who are very conscious and concerned about getting the best that they can afford in education, in health and wellness, in financial advice and expertise, even in the furnishings in their homes and the cars in their garages. They well understand value, not just price. That's why you're here, and we want you to know you are in the right place. Now, I don't mean to scare you about this investment. Dr. Scapolato understands and respects the costs associated in life. He has the same issues. However, his approach to your dental care is based on how he would treat the mother or father of his closest and dearest friend. That includes fair, reasonable, and fully transparent fees, all-inclusive fees, and convenient financing if needed. But it also includes not compromising or sacrificing or taking shortcuts just to shave a bit off the price. I do want you to expect a Rolls-Royce standard from start to finish in your experience here. Were you to shop around, you'd most likely find a number of dentists offering what seems like the same treatment options, even named the same, or using the same resources. Still, all treatment is not the same. Not all dental practices approach creating the ideal smile in the same way. As a somewhat limited but still useful analogy, consider bringing someone in to paint the interior of your home. Now, you might say paint is paint, and to a great degree that's true. And you might find several different painting contractors all using the very same paint, yet creating different results and requiring different prices for the same product. In choosing one over the others, you'll likely consider any number of factors, including their reputation and what their clients have to say about them. Before and after pictures of their work, their experience, their guarantees, and your assessment of their sincere interest in what they do. Are they really interested in creating the most beautiful, most perfect look for your home, or just about getting paint on walls as quickly as possible? You will probably even be rightfully suspicious of anyone offering too cheap of a price. You know they'll be under pressure to take shortcuts and compromise along the way. You will judge their attitude and their conversations with you. You won't say to yourself, well, paint is paint, they're all using the same paint, and they're all doing the same thing, putting paint on walls. So what's the difference? You know there is a difference. Here, we are talking about something considerably more important and more technically complex than paint on walls. It may sound a bit corny, but Dr. Scapolato does not think of himself as a technician, like a mechanic or like a painter. He is about transforming lives. Your life. Not just treating teeth for a winning smile and lifelong optimum dental health, but supporting a winning personality and confident attitude. This is a very special X factor you will appreciate. There aren't a lot of real guarantees in life. You've probably seen the TV ads where a father is talking about the family's financial advisor with his young son. The son asks, "Do you get your fees back if you're not happy?" Dad says, "It doesn't work that way." The son says, "Maybe it should." We agree. And why not? Traditionally, there have been no guarantees in healthcare. You pay your money, you take your chances. But Dr. Scapolato is very sure of his ability to provide the ideal smile, dental health, and patient experience that you will be thrilled with. And that is what you are guaranteed. If you're not satisfied with your new smile or with your experience as a patient, you simply say so, and he will make it right. He will welcome you back and do all that can be done to correct the problem. This is how life should work. Dr. Scapolato is regarded as one of the best dentists in the area. It is evident in his having treated multiple generations of families over his 45 years in practice. Additionally, he supports the local community through charitable work and donations. Professionally, he's highly skilled in dentistry, apparent from the numerous requests to appear in the media, including being the guest expert on the nationally syndicated television show, The Wellness Hour.
You're watching The Wellness Hour, news that makes you healthier. Today's topic, smile makeovers. With us, we have Oak Park's cosmetic dentist, Dr. James Scapolato. Dr. Scapolato, welcome to the program.
Thank you, Randy. Glad to be here.
Now, I know you do more than just cosmetic dentistry and smile makeovers. And one of the things we talked about is that small improvements can make a big difference in not only how people feel about themselves, but how others perceive you. Do you see changes, like you fix their teeth And the people...
My practice takes care of patients from the time they're 3 years old till they're 93, 98, however our oldest patient is.
You've been there 40 years, is that right?
Yes, I am. I have treated patients and their children and now their grandchildren.
Okay.
And it's all about making them feel better about who they are, however small the change might be. It could be the young child coming in and he wants to, feel good about being there and brushing his teeth and making him look nice, and they love it. And then you work up from there to patients in their teens who need teeth straightened in order to feel better about themselves, because teen years can be very difficult with their peer pressure.
Okay.
And what they may want to be doing in the future. And then you get into the adults, where we start to do the things that really make a difference in their life. Little things like fixing the corner of a tooth that's been chipped for years, closing a space.
Are people really bothered by these things? I mean, you would know.
Yep.
Like,
absolutely.
people are really insecure about their smiles?
They are, not with the little things, but sometimes the little things make a bigger difference than when they do a full makeover.
Okay.
Because yes, they're smiling, but they're trying to hold it back. The ones with a full makeover don't even want to smile. Those are the ones we're giving them back their entire smile. But the little things, like I said, replace a single tooth, gives them a full set of teeth again. Whether it be with crowns, with bridge work, which is multiple crowns, or even with a mini implant. And that would be small changes. And then you work up from that into full, what we call reconstruction.
Okay.
Where we totally rehab the entire mouth, give them an entire new smile.
So people with really, really bad teeth and gums, you can work with. They can still have a great smile.
They can have an excellent smile, okay? And even people who have struggled with dentures for years are now being helped by the fact that we have the availability of mini implants to help stabilize those dentures. So they get away from the need for the bulky denture. They get away from the need for denture creams, denture powders, and they can feel, again, more comfortable because that denture is stable. When it comes to all of the work that we're doing, I literally do all of it myself.
By the way, can you spot them as a dentist, like around town people that are embarrassed of their smile?
All the time.
Really?
Yeah, all the time. You can just tell because, one, they're also not happy. I don't mean that they're not happy about life situations, but they're not happy because of their smile. And it's people you see again and again, or they're trying to smile, but they're hiding it.
With their mouth
closed? Put their hand
or?
in front of their face, or them try to smile, and they're not doing it, okay? Those are the people we want to help improve their smile so they feel good about themselves, builds their confidence, okay? It changes their whole lifestyle because people take them more seriously when they're smiling than when they're not. I mean, it goes back to the movies. What is the bad guy portrayed as? Dark teeth, crooked teeth.
Good point.
Okay? The good guy always has the big, bright smile. Okay? And once in a while with the little sparkle on the teeth.
In the movies, you mentioned that. When you want to make somebody look really poor, you mess up their teeth.
Exactly.
You want to make them look dumb?
Right.
You remove a front tooth, right?
But the teeth always show, and it makes a huge difference in the movies. And what is it? We have a perception of that person based on what their teeth look like.
So do you believe people are discriminated against because of their teeth?
Absolutely. It has an effect, I think, when they're interviewed, how their teeth look, whether they smile during an interview. You can have two people coming to an interview, if you want to take it, the proverbial identical twins.
Okay.
One's smiling, one's not. Who's likely to get the job?
That's a good point.
Okay.
The one that looks happy, I guess.
Exactly, because they're more confident in what they have to offer. Okay? But it goes on every day. You walk up and down the street, you look at somebody, they're not smiling, they look depressed.
Or
I don't want anything to do with them. Okay? Somebody who's smiling, when you walk up and you're willing to ask them questions, how's the weather, what's it like?
Now, you're a dentist, so it does not surprise me that you say those things. But you really believe that the smile is one of the most important things.
Absolutely. Let's do a small comparison.
Okay.
You're out in the public, You go to the airport, lots of different people that you get to see there, okay, dressed all kinds of ways, right? When you see people in public is one thing. It's when you see them in their office is another thing, and see the transformation take place. I had a young lady recently. She had finished orthodontic care at another office, and they were having problems dealing with two of her front teeth that were the first teeth, not the permanent teeth, very short-rooted, likely to be lost soon. What are we going to do? We're going to take them out, put in implants, put on veneers, put on crowns. None of those were a great solution for somebody who's 18, 19 years old. So instead, we bonded her teeth, where you put filling and reshaped the teeth, and we bonded it from her front teeth to her canines, because it was the second teeth in line that were possibly going to be lost soon. Okay. So this helped to stabilize them. This also helped to change the look, the finished product of the orthodontics.
The dentist you choose should have a solid reputation for helping people get great results. You may want to consider online reviews. The doctor you choose should be able to provide you with real-life patient testimonials, gladly willing to fully identify themselves and share their comments about going through the same treatment that you'll go through, as well as for any procedures. Walt Disney taught his executives that the key to success was doing what you do so well that people can't resist telling others about you with sincere enthusiasm. At Family Dental Care of Oak Park, we borrow a lot from Walt and from today's Disney company because clinical excellence is not, in our opinion, enough. The overall experience of each patient matters. You'll find that the volunteered, enthusiastic testimonials we have are not just about the actual physical outcome of the dentistry, but about how comfortable the patients were, how safe and well cared for they felt, and about their entire experience. You should also consider your dentist's experience. Dr. Scapolato has seen and treated over 45 years worth of patients, many of them from generations of families. This is a significant body of experience that is carried into the relationship with every patient he now sees and treats. Frankly, you do not want anybody learning on the job, with you and your care as part of that education. Nor do you want just any dentist. You want a dentist who is specialized in your case and your situation, and is an expert at diagnosing and prescribing the best approach for you. This includes both a skilled dentist and his or her use of modern dental technology. They go hand in hand. Technology in the hands of a skilled and experienced dentist is like putting a paintbrush in the hands of Leonardo da Vinci. A masterpiece will follow.
You know, I invited you on the show because I know you do mini dental implants and full mouth makeovers, reconstruction, etc. But with cosmetic dentistry, I was thinking veneers, veneers, veneers. And you told me, you said, Randy, I could save the money, I'm paraphrasing slightly, but I could do more with a crown in many cases than with veneers, which is less expensive.
I find many times that the crown is much more durable long-term than just the veneer. The veneer is a wonderful option. It's harder to maintain it and to keep it as nice looking, okay? My opinion, the crown works much better. And especially today, because we have the non-metal crowns, where you don't show the gray line, especially in front when the tissue recedes a little bit. So you don't have to replace them as often either, which is important to the patients as well. It's something that becomes more long-lasting to them.
In your office, we should talk a little bit about your background. I mean, you did a lot of, you worked hospital dentistry.
Yes,
And I guess you're equipped, that's why I guess you do everything under one roof, because you're, what, extra training with complex cases, working in a hospital?
True, but it's I like doing it in my office because I have the availability of what I use to deliver a service.
What do you mean by that?
Meaning everything is handy. Many times when I go to the hospital, I have to take everything with me, and I have to try to realize what it is I'm bringing. It's like you taking a studio and coming to Chicago.
Okay.
What do I need? Okay.
Okay.
Gets a little bit difficult. It's easier to do it right here. Okay. So it's easier to do in my office because I have everything available, and I'm going to get it done much faster than looking for stuff that I put in the case that I took to the hospital. That doesn't mean that I will perform the sedation. I don't have the training for that, but I have a service that comes in that does the sedation for me. That is a anesthesiologist. Okay, so my life gets easier because of the circumstances and the environment.
So you
that I'm
brought some
working.
photos. What are we looking at?
First photo I have here is before picture of a teenager
All right.
who was having problems with some peer pressure because of how her smile looked, the prominence of her canines. You can imagine the kind of comments she was getting. Okay, so we had a couple of choices. We could either go to elaborate reconstructive work in the sense of either put crowns on the front teeth to lengthen them, to straighten them. We decided to go with invisible braces to straighten the front teeth.
So invisible like trays or like Invisalign kind of things that go on their teeth?
Correct. Much like a mouth guard would be, but you don't see it. They wear it all day long. Nobody knows that it's even happening. You don't see the metal wires. You don't see the metal brackets.
Okay.
So in a very short period of time, we changed her entire look.
Oh my goodness.
Now she's more confident. She's decided to do some work in some high school plays. Now to do a high school play, you've got to be out in the public. So you've got to enjoy your smile and how you feel about yourself. So that's been a big plus for her. One thing you have to notice in the two photographs is there's a huge difference, not just in the position of the teeth. Look at her eyes. Look at this first smile, and she's not, it's a smile, but we had to force her to smile for us because that's the picture we wanted. Asked her next time, she knew exactly what we wanted, but also see how her eyes start to light up.
Yeah.
She's much more confident young lady, okay? She goes on to join the high school theater group, becomes part of a play, enjoyed it very much. I'm sure that's part of doing the play, but I'm sure it's part of the people she's met as well.
Okay.
Let me show you this next patient.
All right.
Here's a before photo. Yes, we got her to smile for the camera, but you can see she was not wanting to smile for the camera. She has been a patient of mine for some time. We had been trying to rebuild. It wasn't working. They were breaking down faster and faster. The worn teeth, the flat look, tells you it's an older smile. Now she's not showing as much tooth as she used 2 years ago. Over time, she's worn them down. So what are our options? You could take all the teeth out, give her dentures. That's not what you wanted, okay? You can try to do some patchwork here and there. You're never gonna get them long enough and nice enough. We had been trying that. It didn't work out because she would wear it down too fast. So we needed something that was far more durable. We had to rebuild her teeth in segments. But the first segment we did was her 6 front teeth on top.
Okay.
When we put those in, you should have seen her face light up when I handed her the mirror.
Okay.
But it didn't light up at first. Her first reaction was that tears came to her eyes because she was so happy to finally have what she always wanted. But she was reluctant to do it because of how much time it might take to do it. And it didn't take as much time as she thought. So I handed her a mirror, and as pleased as she was, the first thing that happened was that tears came to her eyes. She was so excited to see her teeth the way she's always wanted them. Randy, I want to show you one of my special needs patients. And she's special for more than just that. She is also my niece. And this shows you what little changes can do for a smile, even for a person with special needs.
Okay.
So here is her before picture.
Okay.
And you can see her smiling. And
What bothered her?
Pardon?
What bothered her about her
The
smile?
space between her front teeth bothered her.
Okay.
And she wanted Uncle Jim to fix her teeth for her. So I says, okay, we'll do some bonding. You're not going to get into elaborate makeover. Okay, so we did some bonding in order to close the space, and immediately
It's very nice.
it changed her whole smile.
So she smiles more because of this? Because there was a little gap before.
She smiles yet easier is the word I would put. She would always smile, but you can see the difference is just a little bit happier because her front teeth are fixed.
You should be made to feel at ease, secure, and comfortable that all your questions and concerns are heard and answered. If you ever leave the office feeling confused or with unanswered questions, we believe something is wrong. You want a dentist you can and do trust, but not one who expects blind trust, who is impatient or imperial. There's an age-old joke about doctors acting like gods, and God thinking he's a doctor. Your dentist should not exhibit a God complex, nor should he or she scold you for past dental conditions or choices. Not only does Dr. Scapolato work endlessly on clinical excellence and state-of-the-art treatments, he also works on effective communication and interpersonal relationship skills. His goal is a fully informed patient, earned trust. Dentists are specialists in more than just teeth and smiles. There's more at stake than just the best appearance possible. Crowding, bad teeth, gum disease, and other dreadful dental disorders can create a lot of problems, now or in the future, including difficulty with biting and chewing, speech difficulty, facial imbalances that worsen over time, the grinding and clenching of teeth while asleep, sleep problems, and early loss of natural teeth. Poor hygiene leads to bad teeth and gum disease, which has been linked to diabetes, heart disease, and even late-in-life dementia. Dr. Scapolato is expert in identifying such dental irregularities, then treating, and in many cases, preventing progression of these problems. A thorough expert dental exam is a must. It's not just about appearance, it's health, lifelong health. You are going to benefit from the most thorough exam in dentistry in this office.
Is it just the fear of the dentist? Because nobody likes the dentist, right?
Everybody has a story. And they come in every day with a variety of stories to tell about how they were treated as a child, or how they had a bad experience with an extraction as an adult, and they never wanted to go back to the dentist. So part of what we have to do for them is get them comfortable with us and the fact that they can have what they want, okay, and it can be affordable.
Good, good. And you do everything right there. I mean, like root canals, extractions,
Yes.
dental implants to replace missing teeth.
Correct. We do everything right there, always looking to advance with the latest technology to make it easier and more affordable and more comfortable for the patients. And that's where the technology has helped us. And again, it makes it easier on the patients.
There are a lot of reasons people worry about seeing a dentist. They may insist a faulty smile is no big deal, when it really is. One is fear that treatment will be painful. You may remember a personal experience with a well-intentioned dentist that went horribly wrong. Things in dentistry have changed a lot. Not only are there methods and techniques available to minimize and eliminate the discomfort, there are safe and comfortable digital x-rays, invisible orthodontics, and other breakthroughs in dentistry. Of course, that pain-free thing and access to the best technology depends on choosing the right dentist. Another reason people are nervous about a dental examination and assessment is that they think the treatment and procedures will cost too much, so why bother with an exam? But insurance coverage and a variety of financing options can make needed care absolutely affordable for any patient, with payments tailored to the household budget as needed. There's nothing to be embarrassed about. Running a household and raising a family is an expensive proposition. Providing first-class dental care to you and your family is important. Surely something you want, particularly if you didn't get it. But it does have to be paid for, and concerns are understandable. Nothing you discuss with the dentist or a treatment coordinator ever leaves the office. Most of us have families, and budget issues too. We're not Martians after all. We're people just like you. Another worry is that it's going to require too much time off work, away from work or business, or that your child or children will miss too much school or activities. We go out of our way to extend hours and to schedule around your schedule for a minimum of absences, if any. Modern technology and great products and procedures reduce the term of care and the number of appointments. Finally, there are people who have had a bad experience or two with dentists or doctors. You may have been talked to discourteously, hurried, kept waiting way beyond appointment times, and otherwise, frankly, abused. Or you may have experienced pain. Even a hurried or indifferent hygienist can cause pain, let alone the dentist. Dr. Scapolato knows what it's like to be in the chair. Remember, he's a dental patient too. Today, with a great dentist, there really is no reason for you not to have a straight, clean, easy to care for, healthy smile, and the confidence that comes with it. And no reason not to do it now, rather than indecisively postpone it. Here, in this practice, you are experiencing dentistry reinvented. Someone in the same way that Starbucks reinvented the coffee shop, Amazon reinvented the bookstore, and Apple reinvented the phone, the camera, the way we communicate. You are in for a great experience. New beginnings are wonderful things. The author of one of the most famous books on successful personality, self-image, and confidence of all time, Psycho-Cybernetics, Dr. Maxwell Maltz, was gifted an original painting from Salvador Dali. The painting depicts a person coming out of darkness into light. A new beginning. Anyone who has been secretly ashamed of their smile and personal appearance, frustrated with trying to keep misaligned teeth and gums clean and breath fresh, and being uncomfortable eating certain foods, knows about darkness. Your experience and treatment in this practice is going to bring you out into the light with a new, confident smile. There is sometimes a temptation to procrastinate, to shy away from a decision about this, literally at the final step. I really hope you don't do this. Delay has real practical health consequences. It can make treatment more difficult and costlier to do at a later date. This is a great day for a new beginning. Do not hesitate to ask any and every question that may occur to you. One of our fundamental principles is that the better informed our patient is, the better the overall results. Having the utmost confidence in your dentist relieves a lot of anxiety as you go through the actual treatment and procedures. We believe it even affects how calm and comfortable a patient can be. We know there is no shortage of providers for you to choose from, including some who may offer lower fees. But we believe we are the best dental practice and know that you'll agree if you fully understand this process. So we want your every question asked and answered. When you leave the office, you will have started the very sure process of successfully correcting your teeth for a perfect, confident smile and a lifetime of dental health. This is a decision you can be proud of, a process you can trust, with a dentist you can relax and be comfortable with. Thank you for watching and choosing Family Dental Care of Oak Park.